Hi, welcome back to the Get to Know a Nurse podcast. My name is Caitlin and I'm here today with Maddie. Thank you for coming
Yes, of
in.
course.
She is a junior at UPenn,
Mhm.
nursing student from Dallas, Texas.
Yes.
Yay! All right, so if you just want to introduce yourself,
Yeah,
what you
of
do.
course. Yeah, so I'm a third year nursing student at Penn. I am originally from Dallas, like she said, and I'm really interested in like psych and mental health nursing. I think it's a really important field. Along with that, being a nursing student, I do a lot of research, I do some writing. I play on my club lacrosse team. I'm a
Oh.
residential advisor. So it's a lot of fun. I try and involve myself in a lot. So yeah.
Yeah,
Mhm.
you're doing it all. So, before we get into these
Mhm.
questions, think about the next 5 years of your life.
Sure.
If they were a book, a chapter,
Mhm.
what would you tell people that would look like?
I think I was telling someone this the other day that like I want to find a place that all of my interests right now can be one thing for me,
Mhm.
one job or maybe two, like just make it one thing because I'm passionate about so many things. And so it'd be a great way to like combine that. So it kind of would be like, sounds to be cheesy, but like a cliche, like happily ever after, like where it all comes together in the end. I think that'd be really beautiful.
Yeah.
Yeah, so that would kind of be it for me.
Yeah.
Yeah.
Do you have any idea of what area of nursing, or are you kind of open to whatever's coming at you?
Yeah, so like I said, I really do like psych and mental health.
Mm-hmm.
I'm doing that rotation right now, and it's a lot of fun. I had my first clinical the other day.
Yay.
Yeah, it was a lot of fun. Yeah, and also like addiction medicine is really important to me as well. Another reason I came to Philly was because of that. There's a great need, and there's a lot of people that
Mm-hmm.
are really passionate about it here. But I also like critical care. I find that very interesting. I grew up with it in my household. My mom's a CVICU nurse, so
Oh,
I've been seeing it, and she's like, "Oh,
yeah.
you should do it." And I'm like, "Give me a second, I gotta figure it out."
Yeah.
So yeah, but yeah, I'm open to everything, but those are my like
Mm-hmm.
main interests for sure.
Yeah, definitely. Just
Mhm.
whatever opportunity comes.
Yeah, exactly.
Perfect.
Never say no.
Yeah, exactly. So you're a junior.
Hmm.
So what are you most confident about right now at
Yeah,
this stage in your nursing life?
I think for me, I'm confident. It sounds weird. Like I'm confident that learning and education will always be a part of my life. Like I just love learning and finding out new things.
Yeah.
Um, in nursing, it's important to be confident, but it's hard to be confident, right? Like
Mm-hmm.
making those critical decisions and making those um, like critical thinking skills and problem solving. It's very hard to be confident in some of these scenarios, but as time has gone on, I've grown confident in my clinicals and in my labs that like I'm making the right decision for a team and for the patient as well. So yes, those are some of the things.
Yeah. And
Yeah.
nursing is changing all the
Oh,
time.
totally.
Healthcare, new information every
Yep.
day.
Hmm.
Are you excited to learn about all of
Yeah.
that?
Yeah, I absolutely love it. And I think like nurse innovators and nurse engineers and like there's so many places that nurses are that people often forget.
Yes.
And I think that I get to see the beauty in what they work on and like how devoted they are to it and how their perspective as nurses and
Mm-hmm.
people impact what they do. And I think that it's really inspiring as a student and a future nurse to see that. So I'm really excited to see what the future comes. Yeah.
Yeah, and
Mhm.
you wrote about the representation
Mhm.
about in one of your
Yeah.
articles, right?
Yeah.
Yeah.
Yeah. So I did an article recently for 34th Street Magazine at
Mm-hmm.
Penn, and it focused on the nurses in the media. So it just it advocates for. I interviewed three
Mm-hmm.
nurses: Diana Mason, Barbara Glickstein, and Marian Leary. And they all are really involved with making sure nurses stay in the media. Oh, Allie Gorman as well. And they just make sure that nurses have a voice and a space in the media and help contribute to health literacy for the
Mm-hmm.
population, for government officials, for other professors. And it's really inspiring to see them. And it also just continues to convince me that like nurses belong truly everywhere,
Yes.
um, not just at the bedside, not just in the hospital, but in other
Everywhere,
spaces
anything you can
too.
imagine.
It's really great, and the article was really impactful, and I got some messages from nurses being like, oh my gosh, like can we share this, can we do this, and it was
Oh,
just like so heartwarming to see that there's a rallying behind this. So
yeah.
yeah, for sure.
Yeah. What's your motivation, inspiration behind writing for nursing? Because I see you
Right.
do a lot and you
Yeah.
speak up for nurses, which is so
Yeah,
inspiring.
yeah.
So great job
Hmm.
there. So what kind of inspired you to go into that?
So I started writing in high school, but I didn't
Hmm.
really ever do anything with like a newspaper or a magazine. I just like had personal writing that I would do for myself. And I took a class last year and it was about food writing. So it was actually so cool, like writing about how to like put food in a story. Like, oh, you went to a beach as a kid and like your mom made you this sandwich and like not to go dark, but like my mom, like now she has cancer. Like, how does the food like connect you to all of these things,
Yes.
right? And at the end of the class, the professor comes up to me and she's like, "Oh, like you're a writing major. Like, what classes are you taking next?" And I was like, "I'm
You're
not.
not
I'm not."
actually.
And so I was like, "I'm taking this as a sign to like go and start writing." And it started off just writing about different things that I was passionate about, not just
Hmm.
nursing. Like I like psychedelic therapy. It's super interesting to me. Things about Penn, and then it slowly just morphed into nursing because I was like, this is also a passion of mine. Like, why can't I
Yeah.
combine the two?
Combine them.
Right. And so it ended up being this thing for me. And it's like opened up a lot of doors. Like I've won
Hmm.
these two awards recently and
Yes,
like other
congratulations.
and like have other opportunities to interview other nurses. Like it's just fabulous. So I totally want to keep doing it. Yeah. Hmm.
Yeah. Do you think after nursing
Hmm.
school you're going to continue into that?
Yeah, I absolutely would love to. Like I said, I'd love to find a space that I can combine the two for myself.
Hmm.
And or do it on the side. I have been trying to like get in contact with people. I'm talking to New York Times. I'm talking to a few other people to see like how I can combine these two things for me. Yeah, so I totally would love to keep doing it. Yeah.
Yeah. And off that
Hmm.
note, so what does happiness look like to you,
Hmm.
and how can you connect that to what you're currently doing?
So happiness for me, I think, would be like in the little things.
Hmm.
It's not always like about awards and like opening new doors and like getting the next promotion. It's about like grounding yourself and remembering like what nursing means to me is like
Hmm.
truly, caring for the patient, advocating for them. Um, something as simple as like combing their hair or like playing a little game with them. Like those are the little things that matter to them. And it also makes me really happy to be able to do those little things for them too. Um, yeah, so I think that those are all things that are little but add up to be something
Yeah,
big and
they
make me
add up.
happy in the end. Yeah,
Yeah.
yeah.
And then going off that,
Mhm.
how did you get into nursing? What inspired you? Was there a
Right.
single moment, or did you
Yeah.
just kind of build it up?
Yeah, so my mom is a CVICU nurse, like I
Hmm.
said, and all my life she's like, healthcare is the way to go. Nursing, it'd be great if you did nursing, but healthcare is great. Like, okay. And I was like, all right, like, let me try. And so I took some nurse aid classes and some science classes in high school, and I was like, okay, I think this is what I want to do. I took like the little quizzes, like, what career is best for you? And I was like, okay, like, it's actually confirmed. Like, I'm not just crazy. And I think that I wanted a job. I looked at doctor and PA and all that sort
Hmm.
of thing. And I was felt like I was missing the human part of it, with the medical
Yes.
versus the nursing model. It can sometimes feel like the humanness is left behind in the medical model.
Yeah.
I absolutely love the doctors and like they do so much and I really love working with them, but like nursing is the place for me because it's just so human. Like you get to
Yes.
touch them and talk to them and like sit there and like truly be there for them at every second. And sometimes it can get annoying if they're hitting the call bell too many times. All right, but listen,
But
listen,
listen.
but listen, it's still you're there for them, right? So
Yes.
I think it misses the human part of it a little bit. And that really is what inspired me the most. And yeah, it's been a part of my life for so long. So yeah.
Yeah, yeah,
Hmm.
nursing is so hands-on,
Hmm.
I think more than a lot of people
Yeah,
think, and it's so important to get that representation like
absolutely.
you are in
Yeah.
your articles,
Hmm.
switching it up a
Okay,
little.
sure.
So, nursing school and nursing is hard.
Hmm.
A lot to handle, a
Hmm.
lot to learn.
Hmm.
How do you find some time to self-care,
Right,
like refresh your mind?
right. I think it is a lot, and I think that a lot of people could agree with it, like you
Yeah.
said. But I find the places for me to like just take a moment is I
Hmm.
love like going to the gym or like I love trying new food places and like Philly is a great spot for that. Like there's
Yes.
so many good food places.
Yes.
And so trying new food, trying new things, like reading, I love reading. Can't write without reading.
Yeah.
Like it's a fact of life.
Gotta do it.
Yep. And I think that those things definitely bring me back down to earth to continue to keep pushing.
So, what would you say is going really well in your life right now?
I've had like all these doors starting to open.
Mm-hmm.
So, I have these 2 awards that I recently won. I have some research opportunities and all these sorts of things. And I think that all comes with like not only just a little bit of luck, but also just never saying no. Just never doubt yourself. Like you have someone wants something from you, they're asking if you to do a podcast, write a piece, like do something. Just never say no, because you never know what that ends up leading to. So that's what's going well for me, is just being confident to keep saying yes.
Yes,
Yeah.
all about that change, which
Yeah.
is happening all the time in
Yeah.
healthcare. As we
Mhm.
said, it's
Yeah.
every day,
Mhm.
and you seem to be experiencing it a lot, and
Yeah.
there's definitely more to come.
Mhm.
So, how do you adapt to that, and how do you kind of handle it?
Right. So I think that nursing is a career where you're always learning. You're learning from your patients. You're learning from
Mm-hmm.
other staff members. You're learning from, um, like yourself sometimes, like
Yeah.
making like you just make a mistake, and then you're like, okay, like now I'm learning from that. So these changes are for me something that is just another part of that continuing to learn. Like as changes happen, you just continue to learn from them, and you want the best for your patients. You want the best for the nursing field, so you just adapt and make that part of your routine and make it part of your practice, and it just makes you a better practitioner at the end of the day. So
Yeah,
yeah.
kind of like an opportunity for growth,
Right.
especially learning new
Mhm.
things all the time, I'm
Right.
sure.
Yeah.
So, as you've gone through
Mhm.
these
Mhm.
years, what has become clear? What have
Mhm.
you gained clarity
I've definitely
on?
sorry, gained clarity on, you know, that nurses are not just in hospitals, like I've
Mhm.
mentioned before, that there is other spaces for me to find places in and other nurses to find space in, and in Congress, in the media, and other spaces that you don't even think of. And that's something that is just I've like it's like opened up. Like I think a lot of people and myself had this tunnel vision of, oh, they only at the bedside, like they're only in the
Mhm.
hospital, they're only, in a private practice. But no, there's so many other places, and that's
Yes.
just opened up a world for me. So
Yeah.
yeah. Mhm.
All right. And what would you do
Mhm.
if you were not afraid of anything?
Oh my gosh. I think I'm a person, like I said, that I like to say yes to a lot of
Mhm.
things. Things like, you know, the crazy adrenaline stuff, like not nursing
Yeah.
related, like jumping from like doing skydiving and like
Skydiving.
bungee jumping. Okay,
Yes.
bungee jumping does scare me. Like the
Yes.
jumping and the whole that's a little scary. So yes, I that would be hard for me to say yes to. But things like that, I think I would really love to supplement in my life, like do those sorts of things.
Mhm.
And then I think it would inspire me to say yes to even more things in like my professional life too. So yeah. Mhm.
Yes. And what is something you wish people knew about nursing?
Hmm. I think that, like I've been harping on before, that there is just so many places that nurses are, and they just come from so many unique backgrounds, whether they're immigrants, whether they had a first degree before having a nursing
Mhm.
degree and a license. There's just so many perspectives. And I think that when you listen to a nurse and like they have their voice, they just bring so much to the table. I can't, you know, emphasize it enough,
Mhm.
that having their voice at your company, at your in your articles, in your schools, it's just so important because they have so much knowledge, both from previous experiences and both in their clinical practice as a nurse. So I think that it's really important to truly listen to nurses. Yeah.
Yes, and I love that you write about that
Yeah.
again.
Hmm.
So, what has been the most important or maybe your most memorable lesson that you have learned? Maybe just not in school, but like an
Right.
experience.
Right. Even if it's not nursing related, right?
Mhm.
Like if you get that like gut feeling of like this is something that I like and like might want to do, like my food writing class
Yeah.
or um, some other avenue or club that you're joining. Or I had a professor come and speak to one of my classes. She was talking about opioid use disorder, and I got the tickling feeling of
Mhm.
like, okay, wait, I think I should go talk to her. I'm like, oh my gosh, hey, I love your research. Like, I would totally love to be involved. And if there's any way, oh, that's so funny. Like, I have a position open. And I was like, wow. So if
Oh.
you get the tickling feeling and you get the little intuition to go do it, do it. And it led me to an open door of doing research with opioid use disorder and buprenorphine and
Mhm.
access to that. And it's just super fulfilling for me. So
Yeah.
yeah. Mhm.
Yeah. And what do you think has been one of the hardest lessons you've learned or maybe just witnessed?
Hmm. Um, I think that it's sometimes hard to see patients or see families struggle and there's nothing you can do for them. Even if I'm just a nursing student, so you can't do much, but like, even if I was a nurse, right, and they can't afford their medication, or they are at a point in their care plan where there's nothing they can do. The cancer's spread, like the heart is failing, there's just nothing, no other step for them. You just have to be the person that's like, well, what can I do to make you comfortable? Or what can I do to help you right now? Not solve all these big issues that are kind of insolvable, but what can I sit you up? Can I get you water? Can I like go get your favorite blanket? Can I go get you whatever? Just making them comfortable. It's so hard to see them struggle, but there is a space for you to do something for them right now.
Yeah, it's those little
Yeah.
things that makes nursing
Yeah.
so personable,
Right.
because you're at a limit where you can't do anything further except just be there
Right.
for them. So that was all of my questions.
Yeah.
But do you want to, before we end it, do you want to like promote anything or like shout out something?
I just would love to shout out Penn Nursing. Of course, like it genuinely is such a fulfilling program. It's incredibly hard. But I don't think I would be involved in what I'm involved in without it. I truly think that it is a great place for people and to apply and try, and you meet so many different people from unique backgrounds, different countries. I have a friend from Wales. I have a friend I have friends from right here. I have friends from the other side of the country. It's just really impactful, once again, to get those perspectives in one place. And I think Penn Nursing has really been a great place for me. So yeah.
Is that what kind of drew you to it, or was there something else that made you want to apply to there?
Yeah, it's so crazy. I was here because my mom was on a conference, and she, in high school had this deal where, oh, if you want to travel with me, if there's colleges in the area that we're going to, like, let's go see them. And so I looked up like Philadelphia nursing schools, and of course Penn came up. I didn't know it was an Ivy. I knew nothing about it. And so I just like walked on campus. I was like, oh my, it was in the fall. So I was like, oh my God, it's gorgeous.
The best time of the year.
Yeah. And I was like, oh my God. And then I got home and I was like, oh, this is going to be hard. And now I realize why it's like this, why it's so beautiful. And I was like, you know what? Once again, you never say no. You apply, you see what happens, and then here we are. Yeah. So, and then you can't say no to the #1 nursing school in the world.
Yeah.
So then now I'm here. But
here.
Yeah, exactly.
Yeah. What's been your favorite thing about the school, their program, or anything so far?
Yeah, I mean, the professors really truly want what's best for you. They really want to give you access to whatever possible. One of my clinical instructors last semester, who I loved, I was talking to her about my writing and this piece I wanted to do about how nurses cope with death, and like how that's such a big part of their life and how they, navigate it. And she was like, oh my gosh, I have 2 nurses that I would love for you to talk to or interview. And I was like, oh my gosh, great. I didn't even ask. And she just like gave them to me. And I was like, it's so nice to have that support, and not just your class, but outside of it. So yeah, I think that that's one thing that's really attractive about Penn too. And they just do so much like cutting edge research, and like everything's new. Everything is like just so awesome to get to see at the front line. So yeah.
They're amazing. Shout out UPenn.
Yeah.
Thank you, Maddy, so much for coming in.
Yes.
Everyone wish her good luck on her journey through nursing and her awards.
Yes.
So yes, thank you for coming.
Thank you guys.
Thank you for watching.